So now in this lecture, with the continuity of the last lecture, we will continue it with the morphological changes related to the alcoholic liver disease. Alcoholic liver disease or fatty liver, this is, and the cirrhosis, fatty cirrhosis, this is very important for us. Why? There is a slide of the fatty liver in our lab. Whenever the lockdown will be over, you will attend our classes, regular attendance. Then there you will see the slide of this alcoholic liver disease और फैटी लिवर की स्लाइड देखोगे एंड देयर इज ए स्पेसिमेन ऑफ द फैटी लिवर. सो जब भी आप लॉकडाउन के बाद आए तो इसका स्लाइड और स्पेसिमेन जरूर देखें. ठीक है. इट इज alcoholic liver disease is also very important topic for the theory purpose. It is a theoretical question as well as the practical. So it is important for the practical and the theory point of view. You should learn it. So morphological changes related to the alcoholic liver disease. First, I told you that initially there is a development of the fatty liver, hepatic steatosis. So hepatic steatosis after the even moderate intake of the alcohol, that will lead to the microvesicle formations. That is the lipid droplets that will be accumulated in the hepatocytes. So it will appear as a vesicle or empty cytoplasmic vesicles there that will push the nucleus towards the periphery. So lipid droplet will be deposited, give rise a microvesicular appearance in the hepatocytes initially. Then with the chronic intake of the alcohol, that lipid accumulates and creating a large vesicle, that clear macrovesicle. So large vesicle, there is a macrovesicular. It might be the microvesicular or the macrovesicular globules that compresses and displaces the hepatocyte nucleus to the periphery of the cells. And then there might be the vesicles may fuses or coalesce each other, may form a fatty cyst also, or that may rupture and produces a fatty cyst. ठीक है. तो microvesicular, macrovesicular and the fatty cyst formation will be there in a fatty liver, hepatic steatosis. That is the microscopically changes. And macroscopically क्या होगा, कहीं भी कोई चीज डिपॉजिट हो रही है किसी चीज में तो क्या होगा, that will be enlargement of that organ. है ना, बाहर से कोई चीज डिपॉजिट हो रही है तो बड़ा ही हो जाएगा ना. So that there is a large liver that is heavy, about 4 to 6 kilogram of the weight, with the soft organ, yellow and the greasy appearance is there. That I told you, this is a completely reversible change, and if there is a abstinence from further intake of the alcohol, that will be reversed back. So you can see here that it is a outer surface and it is a cut surface of the liver. This capsule, this greasy, slightly enlarged liver, pale yellow in appearance. This is also the gross liver. You will see in our lab also. It is that slightly pale yellow in appearance with the greasy. This is the microscopic view of this. ये जो छोटे छोटे खाली खाली स्पेसेस दिख रहे हैं, these are the fatty changes. Steatosis, vesicle formation is that. Steatosis, and this is the inflammation. Along with this, there might be fibrosis, but in a fatty liver, fibrosis is very less or no fibrosis there. Only that fatty vesicles is there, micro or macro, along with the inflammation. This you can see that. So जब inflammation हुआ तो there is a hepatitis. लेकिन ये hepatitis किसके कारण है? Because of this vesicle formation. So you can diagnose it that it is a alcoholic hepatitis. ठीक है? Because there are the fatty changes of the liver along with the inflammations. So these are the vesicle formation is that. you can see here, this is the microvesicle, this is the small vesicles are the microvesicle, and these are the large vesicle. So micro and the macro vesicles are there. ये न्यूक्लियस जो है पेरीफेरी पे पुश हो गया, न्यूक्लियस तो दिख ही नहीं रहा है ना, बाकी में आपको न्यूक्लियस दिख रहा है कि नहीं, ये न्यूक्लियस है, बट इन दिस सेल्स you cannot see the nucleus because of the deposition of the lipid inside the cell. This is also the fatty liver slides. Okay, so you can see this microscopically and identify it that it is a slide of the fatty liver. This is also the same way. This is the portal triad, and here surrounding that all the liver cells are filled with this vesicle, lipid vacuoles are there. This is the mesenteric stain, special stain to know the about the fibrosis. So ये portal triad से यहाँ पे fibrosis start हो रही है, slight fibrosis is there, and all these are the fatty changes of the hepatocytes. Now another is the alcoholic hepatitis. Fatty liver के बाद में alcoholic hepatitis और that what the changes occurs in alcoholic hepatitis? One is hepatocyte swelling and necrosis. Fatty depositions of the vesicles तो रह गई, साथ में क्या आएगा? There is a ballooning degeneration. So single or scattered foci of the cell undergo swelling or the ballooning of the cells, along with there will be necrosis. तो hepatocyte में necrosis हो गई. Then there are another features is melory bodies. It is also important in pre-PG point of view. क्या होती है melory body and alcoholic hepatitis के अलावा और कहाँ देखने को मिलती है? So other places also you can see it, or in other diseases related to the liver. That what is melory body? First, it is a scattered hepatocyte accumulate tangled skin of the cytokeratin intermediate filaments. What are these? Melory bodies are cytokeratin intermediate filaments as a eosinophilic clumps of in hepatocytes. So how it is seen? Eosinophilic cytoplasmic clump. हेपेटोसाइट के अंदर eosinophilic cytoplasmic clump के जैसे दिखाई देगा मेलोरी बॉडीज. एंड इलेक्ट्रॉन माइक्रोस्कोपिकली जब आप देखेंगे, so what is it? It is cytokeratin intermediate filaments. So these melory bodies are seen in a steatosis hepatitis. These are the characteristic but not the specific feature. Why? Because it is seen other than this steatohepatitis to the other diseases of the liver like non-alcoholic fatty liver disease, PBC, primary biliary cirrhosis, Wilson's disease, chronic cholestatic syndrome, and hepatocellular tumor. So you should know the other causes also of the melory bodies, and what are the melory bodies you should know about it. ठीक है, एक तो हेपेटोसाइट स्वेलिंग हो गई, दूसरा मेलोरी बॉडीज हो गई. Then third is the neutrophilic reactions. So neutrophil permeate the hepatic lobule and accumulate around the degenerated hepatocytes. यहाँ पर स्वेलिंग हो रही है ना, नेक्रोसिस हो रही है, तो डिजनरेशन हो रहा है, तो इसके सराउंडिंग में क्या होगा? न्यूट्रोफिलिक रिएक्शंस. न्यूट्रोफिल्स आर देयर accumulated. Then there is the fibrosis also. Alcoholic hepatitis is almost always accompanied by prominent activation of sinusoidal stellate cell. Fibrosis कहाँ से होती है? Stellate cell से होती है. So there is activation of the stellate cells. This will lead to the fibrosis. And there is portal tract fibroblast giving rise to the fibrosis. ठीक है. So these are the microscopic feature of the alcoholic hepatitis. You will see it. This is the ballooning degenerations of the hepatocytes, and ये जो पिंक पिंक जमा हो रहा है, that is the melory bodies. You will see it this way. These are the depositions of the pink cytokeratin filaments. These are the melory bodies. This is the melory body. These all depositions surrounding in the cytoplasm is the melory bodies. This way also, this is the ballooning degeneration of the hepatocyte. This is the inflammatory cells, एंड जो साइटोप्लाज्म में ये पिंकिश डिपोजिशंस है, दिस इज द मेलोरी बॉडीज, this is the melory bodies, pinkish depositions, and this is surrounded by the fibrosis. Now this was the alcoholic hepatitis. Now the alcoholic cirrhosis. It is also named as the Hobnail or the Lennox cirrhosis. With the continuation of the alcohol intake, that cirrhosis will be developed. In the cirrhosis, there is a multiple nodules will be there and diffuse fine fibrosis are seen. Grossly, initial way, liver will be enlarged, but later on it will shrink due to the hepatocyte destructions on the fibrosis. It will appear as a yellowish and the greasy in grossly, and microscopically there is a fibrous tissue in periportal area and around the central vein. This will be stained with the mesenteric as a blue. And there is a regenerating nodule as it appears in a cirrhosis. So there is a regenerating nodule and the fibrosis around the periportal area and the central vein. Then hepatocytes show the fatty changes and the melory hyaline bodies. So it is a characteristic feature that cirrhosis is due to the alcoholic cirrhosis. And there is a necrosis in the bile staining. As the fibrous septa dissects and surrounds the nodule, the liver becomes more fibrotic, loses fat and shrinking progressively in size. So that liver is converted to the mixed micronodular and the macronodular pattern of the cirrhosis. Ischemic necrosis and fibrous obliteration of the nodule eventually create a broad expanses of tough, pale scar tissue, develop a Lennox cirrhosis. There might be bile stasis, and the end stage alcoholic cirrhosis comes to resemble both macroscopically and the microscopically, the cirrhosis developing from the viral hepatitis and the other causes of the hepatitis. This is the gross picture of this. These bile stasis के कारण ये जो है, that is the greenish in appearance, and this is the nodules. So diffuse nodularity seen in the surface of this liver, and there is a scarring appearance and greenish due to the bile stasis. This is a mesenteric of microscopic view of the nodule. Varying size of the nodules are there, and this is entrapped by the blue staining fibrous tissue. This pura ka pura, this blue stained are the fibrous tissue stained with the mesenteric. So clinically, these were the morphological features. Now the clinical features. First, the hepatic steatosis that may become evident as a hepatomegaly. Then there is a mild elevation in the serum bilirubin and alkaline phosphatase level. With the alcohol withdrawal and the provision of an adequate diet are the sufficient treatment for this hepatic steatosis. तो बहुत ज़्यादा symptoms नहीं आएंगे उसको. elevation of the serum bilirubin तो रहेगा ही, alkaline phosphatase will be increased, and along with the mild hepatomegaly is there. Then hepatitis. If hepatitis develop, then there is a relatively acutely usually follow a bout of the heavy drinking, and there is a non-specific symptoms of the malaise, anorexia, weight loss, upper abdominal discomfort, and tender hepatomegaly. When we do for the investigation, then there will be hyperbilirubinemia, alkaline phosphatase will be increased, and neutrophilic leukocytosis because of the infection. So there is a neutrophilic leukocytosis. Outlook of unpredictable. Each bout of the hepatitis incur about 10 to 20% risk of death. This will be treated with the proper nutrition, and there should be total cessation of the alcohol consumptions. Then the alcoholic hepatitis may be clear slowly. And alcoholic cirrhosis. It is similar to those of the other forms of the cirrhosis, The first sign of the cirrhosis relate to the complication of the portal hypertension, including the life-threatening variceal hemorrhage. Then mild symptoms are malaise, weakness, weight loss, loss of appetite, and preceded the appearance of the jaundice, ascites, and the peripheral edema. Generally, the stigmata of the cirrhosis, there is a grossly distended abdomen, wasted extremities, and caput medusae may be dramatically evident. Investigations when we perform, there is a elevated serum aminotransferase, hyperbilirubinemia, variable elevations of the serum alkaline phosphatase, hypoproteinemia is there, that globulin, albumin and clotting factors will be decreased, and anemia. Cirrhosis may be clinically silent and discovered only at autopsy or when stress such as infection or the trauma tip the balance towards hepatic insufficiency. So these were the clinical features. Now the 5-year survival approach is about 90% of the abstainers who are free of the jaundice, ascites and the hematemesis. And it drops to 50 to 60% in those who continue to imbibe. So in the end stage alcoholics, the proximate cause of the death are hepatic coma, massive gastrointestinal hemorrhages due to the portal hypertensions, and intercurrent infections to which these patients are predisposed, hepatorenal syndromes following a bout of the alcoholic hepatitis, or there might be the hepatocellular carcinoma in about 3 to 6% of the cases. So these are the complication or the cause of the death due to the alcoholic liver disease. So here we are finishing the alcoholic liver disease. You should know about the etiology, morphological changes, what are the complications of this alcoholic liver disease. All the things related to these are the important.